So we're going to talk now about a term that some folks typically hear, and that's called cervical radiculopathy. It sounds like ridiculous, which it probably is, but cervical radiculopathy is when we have pain that goes down our shoulder and down our arms. Radicula means branch, and pathy means sick, the sick branch. And this is a model of the cervical spine, and there's 7 bones in the cervical spine. This is our first cervical bone, second, third, fourth, fifth, sixth, seventh, and then we get into what's called the thoracic spine or the mid-back. The nerves exit out the tunnels going down the arm to give sensation and movement to the hands and to the muscles in the arms. What can happen over time, a lot like the lumbar spine, is we can get bone spurs that can pinch on the nerve roots and cause radiating pain down the arm and can really make people miserable. The good news, fortunately, is that cervical radiculopathy, for the most part, the body can heal itself. Now, that usually is a combination of time. Sometimes I send people to physical therapy to do a little traction to try to pull and open up the nerve tunnels to try to help people's arm feel better. And occasionally I'll send them for a special type of injection called a cervical epidural. The fortunate news is the vast majority of folks will get better on their own. Now, if they don't get better, sometimes we go in surgically and we actually remove the bone spur and stabilize the bones that are causing the problem. And that's a cervical discectomy and fusion. That's where we actually fuse 2 bones together. There are newer technologies now where we actually have movable parts called a cervical disc replacement, which is currently approved for 1 level in the United States. But the good news is, cervical radiculopathy, like most conditions in the body, if we just give the body enough time to heal itself, will get better and shouldn't require any surgical intervention. So that's our short discussion on cervical radiculopathy. Have a good day.